I am a researcher from the Australia and New Zealand Dialysis and Transplant Registry, or ANZDATA. I'd like to welcome you to our research group. We are delighted that you are interested in being involved, and we thank you for working with us in this research. We are a research group interested in men and women with kidney disease who want to have a family. We work collaboratively across the Royal Adelaide Hospital and ANZDATA Registry.
In our research group, we have Associate Professor Shilpa Jesudasan, who is a kidney specialist doctor at the Royal Adelaide Hospital. Shilpa works in a kidney clinic at the hospital and has expertise in pregnancy and parenthood in kidney disease. She has a special interest in working with women planning to have children. Her research in this area has led to changes in how women with kidney disease are counselled about pregnancy. She is also the clinical director at Kidney Health Australia. We also have Professor Stephen MacDonald, who is a kidney specialist doctor at the Royal Adelaide Hospital. He is also the executive officer at ANZDATA Registry. Chris, Emily and I are researchers from ANZDATA. We are from the ANZDATA Registry. It's a big database that collects lots of data from patients who are receiving dialysis or kidney transplantation. We are located at the South Australian Health and Medical Research Institute, or SAMRE. Our research is looking at various parenthood outcomes in mothers and fathers receiving dialysis or kidney transplantation.
We are doing this research to help patients and health professionals to work together to make decisions about family planning during kidney disease.
We have done a research project interviewing women with kidney disease about their thoughts and experiences of having children. For many of these women, pregnancy was a challenging and uncertain time. Women spoke of pregnancy as an important and a difficult decision that they had to make with the support of their doctors. We need to prioritize understanding patients' experiences, values, priorities, and needs when making decisions about parenthood. We have also done another study looking at pregnancy in women with kidney disease, partnering with AMOS, which stands for Australasian Maternity Outcomes Surveillance System from 2017 to 2018. In this study, we have collected information about the pregnancy, information about the kidney disease, and about the kind of care that women receive during the pregnancy, the mother's health during the pregnancy, some information about the labor and delivery, and what happened to the baby. Importantly, in this study, we have collected this information for the first time about dialysis and transplantation in pregnancy across Australia. With this information, we can better understand about kidney disease in pregnancy and use this information to find out if women are receiving appropriate care, understand gaps in their care, to improve delivery of care to these women. We have also done another study in women with kidney disease during their pregnancy by looking at data collected from 1990 to 2012 in the South Australian perinatal dataset. In this study, we looked at how many women were affected by kidney diseases during their pregnancy and the health of the mothers and their babies before, during and after pregnancy. We also looked at similar information in the ANZDATA Registry. From these studies, it came across that women with kidney disease need careful pregnancy planning, monitoring, specialized management supported by shared decision making to have better pregnancy outcomes.
So far, we have talked about the mothers whose health is obviously important for the health of the baby, but we can't forget about the fathers who are also very important to the health of the pregnancy and health of the baby.
Our research group is also interested in looking at fatherhood in males receiving treatment for kidney disease. We know very little about the influence of males receiving dialysis and kidney transplant on fatherhood. We know that some males may experience fertility issues, but we don't really know much more about it. Recently, we have done a study looking at a large group of fathers from Australia and New Zealand receiving treatment for kidney disease by looking at the data from 1970 to 2016 that we have collected at ANS data. We saw good outcomes in babies fathered by men receiving either dialysis or transplant, even in those exposed to immunosuppression after kidney transplantation.
So what are we doing next? We are currently doing a study looking at men and women with kidney disease.
In this study, we are linking data from different datasets to answer some key questions about labor and delivery, how the mothers are doing after giving birth, health of the baby soon after birth, and how babies are doing in the long term, for example, their growth and development.
In this study, we are looking at data from the mothers and the fathers receiving either dialysis or transplant and their babies across Australia from 1991 to 2013. We are now doing the analysis for this study.
We are also thinking about developing a survey study to find out more about how women with kidney disease like to be counselled and receive pregnancy information. We are currently planning on setting up a registry that collects lots of data about women with chronic kidney disease. We are also planning on interviewing clinicians to get their thoughts and experiences about consulting patients with kidney disease who are planning or faced with pregnancy.
You are joining a research group who are very much interested in improving care for men and women with kidney disease who are faced with or considering parenthood. We have done a lot of research in this area over the past years, but we are currently doing and also planning more research to fill gaps in knowledge to be able to give the best care possible to those who are thinking about having children while receiving treatment for kidney disease.
By joining our research group, you may be able to share your own lived experiences related to pregnancy and parenthood. You can let us know your thoughts about research areas that we should prioritize in. There's also the opportunity to be involved in designing some future research studies, data collection tools like developing some of the interview questions for clinicians' perspective study, and also sharing research findings back to the community, for example by developing summaries of research findings for patients and families. To familiarize yourself more with this research, we can provide you with published research papers in this area, relevant websites, and AMOS study video, and we are happy to provide you more information about these. If you have any questions or want to discuss anything, please don't hesitate to contact us.
You have the opportunity to be involved in so many aspects of this research. We look forward to working with you to bring the research findings back to the community. Thank you very much, and we are looking forward to meeting you soon.